we have with us Dr. Parth Bansal. He specializes in orthopedics and spine surgery. He is associated with Max Hospital in Mohali. So, Dr. Parth, it's a pleasure to be talking to you today. So, at the MAPICON, you've spoken about orthopedic and spine fractures.
Yes.
So, could you elaborate it for our viewers?
Absolutely. So today I spoke about osteoporotic vertebral compression fractures, which is basically fragility fractures which occur in the elderly population, mostly in the elderly population or patients who have weak bones. So these are very common. These are actually more common than hip fractures, which a lot of people know about.
Yeah.
And these cause a lot of pain, deformity, they cause a lot of morbidity and mortality in these age groups. And I just spoke about the importance of detecting them first of all, and then how to diagnose and treat.
Alright, and how common it is?
It's about 3 times more common than hip fractures in the elderly.
Alright.
1 lakh to 2 lakh per year in India, at least, probably more than that.
What are the basic causes?
The most inherently the basic cause is weak bones.
Yeah.
We're talking about basically the bone structure gets weak. There is not enough structural integrity to the bone, and then trivial traumas like falls or just rotational forces, they can cause fractures in the elderly. And a lot of these times, these fractures are not even detected because they are just attributed to back pain of old age.
Alright.
Patients are not even evaluated for these.
Okay, so when do they know it's time to like...
See, about 20% of the patients, they will come to you. That we have back pain, fell down and let's get an X-ray.
Yeah.
Other than that, it's mostly when people come to you for routine checkups. A lot of patients will come to us with complaints of back pain or generalized body aches. Then we'll get X-rays done and these will be incidental findings. It will
Alright.
not always be detected because patients came just for that. We get X-rays 3 or 4 months later and then these might be.
Sure. Okay. And what is the downtime after the...
So see, downtime is basically because of the pain and the deformity that it can cause. So what happens is that because of the pain, because of morbidity attributed to it, the patient will take bed rest. So we don't want the patient to be physically inactive because the bone is already weak. If the patient becomes physically inactive, then the weakness worsens and it predisposes these patients to even more fractures. Once you have a fragility fracture in the spine, you are more predisposed to having fractures in the hip, in the spine, and in the wrist. And the 1-year mortality after these fractures is also very high, so we need to treat them very quickly.
Sure. So any message for our viewers? Anything generic?
Yes, absolutely. Because I think so many of the times we have older patients, older relatives who complain of pains in the body, in the back, and we ignore them saying कि नहीं यार बुढ़ापे का दर्द है छोड़ दो. We should not be doing that. We should be getting these patients evaluated. We have to talk about bone density. Bone density screening should be done for all patients above the age of 60 so that we know when the bones are weak, we know when to treat them, and so that we can prevent the fractures from happening rather than treating the fracture.
Sure. That was a very good information for us. So thank you, Dr. Parth. It was a pleasure talking to you today. Thank you.